Okay, I want to thank our audience. Welcome our audience. Welcome to the Ready, Set, Gemini podcast, the news edition. I am your host, Dan Mora, and my co-host directly across from me.
Hey everybody, it's Frank Smithson here.
Thank you for joining us. As always, we love feedback. We love your comments. Please do that. We'd love to hear some ideas for new shows. Subscribe, like, follow, comment.
Yes, do that.
Yeah, so we're going to talk about universal healthcare.
Universal healthcare, that's a big one.
It is a big one. I've been thinking and pondering about this for some time. Real quick, though, we have another news that only is going to require a few minutes here, and that's a vocational school. A couple of vocational school executives, quote unquote, were arrested last Wednesday.
Wow.
Yeah, they were providing, they're 18 felony counts, including conspiracy, forgery, grand theft, and insurance fraud. Estimated value of $1.7 million between 2017 and 2020. The school was submitting fraudulent documents to 9 carriers and billed for services that weren't provided.
Wow.
Yep, including, as the headline of this article is, someone that had passed away. Submitted benefits for somebody who passed away.
I'm curious with the voucher counselors that were working with these schools and how that works out.
I didn't do that research, but there's two of the
schools themselves,
quote unquote, executives.
Did we work with any of these schools?
Schools. So this wasn't a school. This was a vocational rehabilitation counseling company.
Oh, it's the actual counseling company, not the schools themselves.
Correct.
Oh, wow. Then they didn't release who those were?
I take that back. It says it's a school. So maybe it was a school.
Okay.
Yeah.
I've heard the schools have some cahoots, but I'm curious where the voucher counselors that are recommending the injured workers to those schools, where that transparency lies.
Yeah, well, that's a good question, because actually counselor isn't required in the system. Yeah. So that's probably what happened was the school was getting folks in and just not providing services.
That's horrible.
Yeah.
Taking advantage of people that are just trying to get back into the workforce and learn.
Right.
It's rough.
But yeah, back to universal healthcare. So this has been a big concern of mine in our industry and workers' compensation. And what is workers' compensation? Why does a case for workers' compensation have a need in a system, in a judicial system? And usually, a lot of the arguments that go to the WCAB are about care.
Okay.
So the injured person argues that they need particular care or more care, and the insurance company and employer is saying, no, you don't need that care. And this argument, I think, is mostly stems. The reason that I think that it's so contentious in that beginning phases of care is because it sets the stage for care long term.
Okay.
And the care long term equals what's called future costs, which is exactly what happens. That's what a judgment or a settlement is based on future medicals, right? There's other arguing, but very little about the wages, because wages are very binary. This is what you make, and so the chart says this is how much you're going to get.
Mm-hmm. That's the easy part.
Right. So this argument about care during the case, assessing the injury, so that you understand what the future injury is going to look like. I have a very big concern that universal healthcare is going to completely wipe out workers' compensation, dare I say.
Interesting.
Mm-hmm.
Yeah, they do these things when you go into if you have an injury, you go into an emergency room. They try to understand how it happened, the medical facilities themselves. So they'll ask questions like, oh, did you do this at work? Or obviously they're looking for criminal type of intent too. But I think a big piece of that is to understand where the insurance is going to come from.
Right. So there was a bill that was brought up at actually for several years, a bill has continued to be brought up to the governor to be signed. In January, though, the bill that was led by the Nurses Association. Let me find my information here. In January, there was a bill that was taken off of off to be voted. So this is AB 1400. This is widely supported by the governor and by the Assembly Speaker Rendon. California Nurses Association, that's who brought this forward, is AB 1400. But it was taken, the sponsor, the legislator that put this up, took it off of the ballot to be voted on. And that received some criticism, but the governor had a study that was commissioned that finally got the results of that study in April. And so a San Francisco Chronicle story that I read said that basically Newsom believes that universal medicine is inevitable. It's what he thinks. But there's really no plan is kind of the problem. And what this $5 million price tag for this report that came out, it just basically said that the current medicine in California is fragmented, unorganized, unsustainable, and that costs will increase by 30% in 9 years.
Wow.
And so they're advocating to remove the distinctions between private and government coverage. And there's some big stumbling blocks here, and probably why it got taken off from being voted. Number one is the federal funds are very important, needed in order to fund this universal medicine, but they need to be repurposed, and that was part of why it was pulled off. And then, but what they did in this report, what was important that they accomplished, and it was released in April, was a unified financing system, quote unquote. And so a big portion of the discussion was, and they didn't go far enough. Interestingly enough, this report was endorsed by all the commissioners except one, which was from the Nurses Association, that said it just didn't go far enough. Mm-hmm. The report says unified financing system several times, but it doesn't go far enough, according to this nurse commissioner, to say single payer.
Gotcha.
So unified financing system and single payer is where where really things are moving forward when it comes to universal medicine. I kind of agree with the governor that it's inevitable that this is going to happen.
I think it will too. Where I'm curious is when we talk about money, that's really where everything, where the rubber meets the road.
Yeah.
So if you're an injured worker
mm-hmm.
and we have universal health care, you go into the medical facility emergency room and you say, I was injured at work. Mm-hmm. Are they going to pull it out of the universal system, or are they going to say, no, we don't want to pay for that? That can stay in the workers' comp. Like, who's responsible, right? So why should the government pay for it when it was the work entity or the employer that was responsible? So
either way, in your scenario,
sure,
it doesn't change the care that's happening for the injured worker.
Yeah.
Right. So that, I think, is the key, regardless of who pays for it. Will a doctor deny payment because it's a work injury? The answer is probably likely no, because they're covered. If they're not covered under the work comp system, then they'll be covered under the universal medical.
Well, that's the question for the carve out, right? Like, are they going to very specifically say we're not going to cover work related injuries mm-hmm. in the bill? And that would be interesting. That being said, if you're aware that there's free universal medical care and you get an injury, let's say it's minor, mm-hmm. why would you want to go through the work comp system when we already know the pain's there, when you could just go walk in and get yourself fixed immediately?
You're an injured worker and you walk in and you're concerned about being treated because it's a work injury. You're not going to say that it's a work injury, right?
So you get sprayed with a bunch of toxic chemicals, work in agriculture in a field, then what do they do? Is it going to be a similar situation? They're going to walk into the emergency room. They're going to be sick. They're going to say, I huffed down a lot of this stuff and I need to be fixed now. Mm-hmm. They're probably just going to say, fix me.
Yeah. Regardless. Yeah.
So man, I'm curious what our our audience is thinking about this system, if it's something that's going to be sustained or not.
I like talking to the smartest folks I can find at the conferences and our clients, and I really have a lot of respect for our clients in their industry. And I've brought this topic up many times, and I've gotten maybe literally one of the smart people that I approached that bit and said, "Yeah, I'm very interested and concerned about this."
Okay.
That's one. That's only one. So yeah, I'm very interested to see how if we get any comments on this topic. But I think the bottom line is I think it's inevitable. Number one, and I think number two, I just see it. It will be very consequential to workers' compensation, California workers' compensation. I'm very concerned that.
How are they going to navigate that change so fast? Like, I just know how slow everything goes. So if this does happen,
well, yeah. So I think, and that was part of the comments actually that I really, in reading this Chronicle article, and I read another article that was very good, and they basically said that they know that they can't one fell swoop do this. They're piecemealing it together. They also think that there needs to be some major steps. So a bill would be a big step, and then piecemeal they're doing smaller steps. There was actually a big increase in access to healthcare. It was expanded to undocumented workers this year. So that was signed in the budget bill. In the budget, for this is Medi-Cal, the budget only covered 50 and older in 2022, and then in this year they covered 19 to from 26 to 49 years of age. So they actually had in 2016 the budget, the Cal Medi-Cal covered 2016, they expanded it from 19 years old to 25 undocumented. In 2020, 50 years and older. And then recently, this year actually, it's 26 to 49. And they don't call it documented or undocumented. They call it income eligible is how they do it.
Interesting.
So definitely expanding healthcare piecemeal for Californians. But
in this situation, though, workers' compensation is not going to be impacted, I would imagine. Or do you think it will be?
Well, that's a great question, too, that I'd like to hear from, our audience. Does Medi-Cal actually, has it changed the expansion of Medi-Cal? And we're talking from 2016 to now. How's that affected our clients in any way?
So we have there's a bit of a culture of fear of being an undocumented worker in the United States right now. So, the likelihood of them coming forward to seek medical attention for something small is probably still, impacted to some degree.
Some degree. California, those led the way. I mean, they're
exactly.
For sure.
So if we're making it more accessible for them just to get regular medical treatment, would that make them feel more comfortable to come forward and then also suggest, hey, this was a work comp related injury?
Yeah, it's possible.
Are there fears there?
What's interesting is the United States is a holdout for universal medicine. I mean, I looked at a map of countries that have basic medical care for citizens. China, 1.4 billion people have basic medical care. India, 1.4 billion people have basic medical care. In Mexico, you have basic medical care. Canada. So it makes you wonder. Most of the European nations do. Eastern Europe is an area that is still largely does not have universal health care, and then Central Africa largely does not have universal health care. Very interesting how we've been such a massive holdout. California, 2% of the gross national product of the nation is spent on California healthcare. It's it's $517 billion in 2022 to provide healthcare in California. This is the fifth largest economy in the world, just bigger than India and Germany. The entire country of India, the California economy.
I'm curious of the elective healthcare versus the necessary healthcare in California if those numbers are all in the mix. Yeah.
It's a lot. It's a big giant dollar sign. Giant dollar sign.
So if speaking of elective healthcare, like a lot of what healthcare is, cosmetic things like that, when we talk about universal healthcare, those types of things would not be taken into consideration. I'd imagine
I highly doubt it. Yeah. I highly doubt it.
Yeah. When I think of the U.S., I think of you can get the best healthcare in the world if you have the money for it. Even if you have insurance through your company, like you still need to pay to get the really good stuff.
Yeah.
Right.
Mm-hmm. So yeah, big topic. I'm really curious to hear what our audience has to say about universal health care, and it's the future of California workers' compensation.
Yeah, let us know if you're worried. Let us know if there's not a big deal.
Yeah.
Cool. Thanks, Dan.
Yeah, so that'll wrap up this discussion. Again, we want to hear from our audience. Like, subscribe, follow, comment. We're excited to hear from you.
Have a good one.